Tell me about your migraines nowadays.
Okay. Right now, I have kind of a slight headache every day. And then about once or twice a week, it'll get to what I say the ugly part. It'll get where it's all on the right side behind my right eye, just throbbing, stabbing pain. Sometimes my face will go a little bit weak or numb, so to speak. I'll have some nausea. I'll see spots and stars. Sometimes that's my aura before.
Okay.
Sometimes not. Sometimes there's no warning whatsoever. It just comes out of nowhere. And of course, the typical treatment is just go to bed in a dark room.
It sounds like you're talking about two types of headaches. You're talking about one which is a little bit more common, and then you're saying several times a week it becomes ugly.
Right.
Tell me first about the one that you think is more common.
It just feels like a headache, like a Tylenol headache, something that you can take an Advil or Tylenol and it nips it in the bud. I would say probably this time of year is triggered by allergies.
Okay.
Where I live, it's farming, so they're cutting a lot of corn and beans, so there's a lot of dust in the air. And typically October is my worst month of the year for migraines because of all the things in the air and the weather change and that sort of thing.
When you're talking about this headache that you think is more common, not the one that you're calling the ugly headache.
Right.
Where is it located in your head?
It's still on the right side, still, behind my eye, kind of above my ear. Always on the right side.
Would you call that mild, moderate, severe?
Probably mild.
Does it stop you from doing things you want to do?
Not really, because like I said, sometimes the Advil will nip it in the bud, or an Aleve will nip it in the bud. And then it's like when it turns ugly, it's on a dime. It could be, I could have some warning, or it just out of nowhere goes, oh, and it's just, stifling, and the light hurts my eyes, and I have to, so that's the scary part. If I'm out and about somewhere and it hits, my vision, my right eye starts to struggle, and the light's very hard for me to handle.
What does the headache feel like? Does it feel sharp? Does it feel stabbing?
It's a throbbing,
Okay.
and it's like I can hear my heartbeat in my ears, if that makes sense. And it's just a throbbing, and it kind of shoots back to the back part of, it starts here and it kind of shoots to the back of my head. And a lot of times there's obviously nausea involved. I don't always vomit with it. I have, and that's where I just have to get still and in the dark. And
you mentioned that light bothers you. How about sound?
Sound is always, I'm kind of jumpy around sounds anyway. I'm kind of overly sensitive to sounds. So if something's really loud, it does affect me, and it sounds louder during those episodes.
How about strong smells?
I haven't really noticed that.
And this might sound strange, but do you ever get ice cream headaches?
Like a brain freeze?
Mm-hmm.
Yeah, but it's nothing like that. Because the brain freeze, you can kind of almost like warm your brain back up. And to me, when I have those kind of headaches, it's everywhere, It's not just the one-sided.
And do you get motion sickness when you're in a car?
I do not.
You're not?
Mm-mm. I do get, like on a cruise ship, I do get a little motion sick on the cruise ships. But it's treatable, And I've never had a migraine on a cruise, so I don't know how that would interact. But
how do you treat your headaches nowadays?
Like I said, the everyday headache, I try to take an Aleve or Advil over the counter kind of thing. But I take Fioricet. Did I say that right? Yeah. And it will nip it in the bud typically. I'll take it, and if I'm having some extreme nausea, I'll take a Phenergan and be able to go on to bed. And that'll kind of get me into a good deep sleep to be able to sleep it off. There are times that I wake up and it's a little better, and there's times that I wake up and it's a little bit worse. it really depends on how soon I'm able to treat. If I'm able to treat it like in the first 15 or 20 minutes, it seems like it goes away more quickly. If it's an hour later before I can get home and, medicate or whatever, it's harder to shake.
How often would you say you take what we call non-steroidal anti-inflammatory drugs? Medicines like Aleve, medicines like Motrin, Advil, ibuprofen, naproxen.
I would say right now I'm taking Advil almost every day.
How many times a day?
Typically just once.
Okay.
Because I wake up with a headache.
How long have you been doing that for?
Probably the last 6 weeks or so.
Okay. And before 6 weeks ago?
Just as needed. I wouldn't say every day. I didn't have many migraines through the summer. So I didn't really have to treat, I'd have an occasional headache, obviously, like most everybody does. But I would say once or twice a week.
Do you think you get into a cycle where you start taking a lot of those medicines and then you need to take more and more?
I've never noticed that I needed more.
Okay.
If it's just one of the regular everyday headaches, I'll take a couple Advil or an Aleve, and it seems to nip it in the bud. So.
And how often are you taking headaches where you need to take something like a Furacet for?
Right now, I'm having 2 to 3 a week.
Okay.
That stop me in my tracks, and I have to go to bed.
And if you don't treat it and you wait a little bit too long, does your skin start to actually get sensitive?
Yes.
What happens?
I just feel like, even like if my husband comes in and says, "Hey, how are you feeling?" That touch just feels like fire under my skin. I'm itchy. Not where like, sometimes I'll take a Benadryl, and that'll kind of help me get back into the deep sleep I need to be, but also helps with that reaction.
Do you know what we call that? Has anybody ever told you?
Mm-mm.
We call that cutaneous allodynia. Cutaneous means like the skin.
Right.
Allo means all, and dynia means painful. It's where non-painful things become painful.
Okay.
And it happens in a process we call central sensitization. And basically what happens is your nervous system becomes overly sensitive. And you don't want people to touch you.
Right.
You might want to take off glasses,
right,
or loosen jewelry.
Right.
Because you've had the headache for too long.
Gotcha. Yeah, even like the dog sleeping beside me on the bed, that touch, I'm like, okay, you got to go on. Yeah, so I've never, knew the name of it. I didn't know there was such a thing.
Are you taking anything to try to prevent headaches?
I do Botox injections.
Okay.
I've been doing those for years, and they seem to work very well. I tried the once a month injection, not Emgality, but.
Okay, you took one of the new CGRP
Right.
monoclonal antibodies.
Yes.
So these are medicines that try to prevent migraines.
Right. We stopped the Botox for a while and tried those and it worked very well for about 4 months.
Okay.
And then the migraines started coming back. So that's when we stopped those and went back to the Botox. Botox has just worked so well for me for years. And I missed a dose this summer, and I don't know if that's why these are rearing their ugly head now, So I'm hoping to get that resolved.
How young were you when you started to have migraines?
I would say 16 or 17.
Okay.
I really didn't know what was happening. So that was in the late, mid-90s, 94, 95. And my mom struggled with migraines, and so she kind of recognized some of the issues. They got worse in college. Of course, in college you don't sleep well.
Mm-hmm.
You're reading a lot, studying a lot. And so that's when, I started seeing a neurologist, and that's when, they introduced the Max Halt, and I can't remember the nasal medication.
Okay, what are the triptans that you took
The
for that?
triptans, yeah. As I got older, the triptans made my heart race and my blood pressure go up, so we had to kind of stay away from those. But the Maxalt worked pretty well for a while. But as I noticed as I got older, I had several migraines during both pregnancies. Of course, that could be hormonal. It could be all kinds of things. No sleep. Obviously, there's so many things that trigger that you have to learn over the years.
Well, what do you think are triggers for you for migraine?
Definitely a change in sleep pattern. If I stay up too late, get up too early. Also, when the barometric pressure changes, when it's dry, and then it rains for 2 days, I'm going to have a headache. I can just go ahead and, even my kids will say, it's going to rain, Mom's going to have a headache. They know. Younger, I noticed if I would eat at places like Olive Garden or some places like that had a lot of cheeses, aged cheeses in their food, sometimes I would have a migraine. I'm kind of a wine drinker. Red wine sometimes is a trigger, so I kind of steer away from that. But typically the barometric pressure changing, and then like right now, like I said, they're cutting the corn and the beans, and there's a lot of dust in the air, and those are triggers for me as well.
You mentioned some triggers. Some of them are environmental. Other ones are food. Another one is lack of sleep.
Right.
Anything else that you think is a trigger?
Sometimes stress.
Okay.
Obviously stress affects us all differently. And it's a matter of how stressful an event could be or could not be. Like the death of my father, it triggered a pretty long series of migraines. Of course, you're crying for several days and that sort of thing. But I can't think of any other triggers.
Anybody besides your mother in the family with migraines?
My dad got them later in life, like when he was over 65. And it was not on a regular basis, so we would never figured out his trigger. It would just come out of the blue. But my mom struggled with them her whole life. And, I can remember as a child, Dad would say, Mom's in bed with a headache. Let's just let her be. Okay. And so, of course, then they treated pain with narcotics. And I have since learned narcotics makes them worse.
Right.
So, it's kind of funny how things, go over the years.
When you have the headache, when you have what you're calling the bad headache, the migraine, do you have a warning sign that's going to happen?
Sometimes there's an aura before. Sometimes my vision will get a little hazy in the right eye. Sometimes I'll have lights, and stars and dark spots. And they're typically like in my peripheral vision. And as the migraine gets worse, they move into my full vision. But that's typically the only pre-warning that I have. As I've gotten older and I guess more accustomed to them, I've learned, okay, it's coming. I need to go ahead and get something in my system to try to combat it, so it doesn't get to the point that I'm bedbound.
Some people with migraines describe not just an aura, not just that warning about half an hour beforehand. They also describe what we call a prodrome, where they say they feel kind of drained even the day beforehand. Do you think that describes you? Like, is there something different that you noticed before?
I really can't say that I've noticed different. I have, other diagnoses that causes fatigue. So sometimes I don't know what's causing, which is causing the fatigue. But I would say the day of a migraine, sometimes I do feel more tired.
And how about after the migraine?
Sore. My head's very sore. Still a little sensitive to light and to sound to some extreme. And that's when like an Aleve or Advil comes in. I take it and it, takes care of that soreness.
Okay, well, thank you.
Yes, thank you.
Look over here.
Okay.
Just follow my finger with your eyes. That's good.
You're tricking me.
Good. Does this feel the same or different on both sides?
The right side's a little numb, so it feels just kind of tingling on the right side.
Over here?
Up here.
Okay, so you feel that over here?
Mm-hmm.
How about down here?
Mm-hmm.
Does it feel about the same?
Yeah.
And up here?
Not as much on the right side.
Okay. Okay. Open your mouth. Stick out your tongue. Okay, wiggle it side to side. Okay, now put it inside your mouth. Go like this. Good. Do it on the other side. Good. Open your jaw. Okay. Say Okay, good. Lift up your shoulders. Okay, good. Turn your head that way. Good. Turn it the other way. I want you to put your hands out in front of you. Turn them over like you're holding up a tray. Close your eyes. Shake your head no. Okay, look at me. Go like this one thumb over the other. Yep. Go faster.
A little tricky.
Okay. Do that with your pinkies.
Oh.
Okay, do that with your whole hand. Go a little bit faster. Now go the other way. Okay. Good. Squeeze. Okay. Pull me towards you. Good. Push me away. Lift up your arms like this, nice and strong. Okay. Spread out your fingers. Turn your hands over. Put your thumbs up like this. That's good. Good. Embrace yourself over here. Can you lift up this leg? Keep it up strong. Okay. Do it on this side. Kick out. And keep it strong.
Okay.
Okay. Bend your knee. Kick out. Bend your knee. Lift up your whole ankle. Lift up your ankle. Push down. Okay, now just try to lift up your toe towards you. There you go. Lift up your whole ankle. Push down.
Ooh.
Oh. Push down. Okay, lift up your toe. Okay. Can you push your hand in towards my hand? Now away from my hand. Good. Towards my hand. Away from my hand. Okay. And just relax your arm. Yeah, I know it's hard to stay relaxed when I'm pushing on you with something. Try to relax your arm. Let me see your hands here. Let's try to relax your hand. Lift up your thumb. Good. Lift up your thumb like this. Perfect. This is our uncomfortable test, so I apologize. Okay. Do you feel buzzy?
Mm.
Do you feel buzzy?
Mm.
Do you feel buzzy?
A little bit.
How about over here?
Mm.
Does that feel different?
Mm-hmm. A lot stronger on this side.
How about here? Do you feel that? How about over here?
Yes.
Okay. You feel this? This is down. This is up.
Mm-hmm.
Close your eyes. Which way am I going?
Down.
This is down. This is up.
Mm-hmm.
Which way am I going now?
Up.
Is this
Down.
easier for you on one side or the other?
The left side's easier.
Okay. Do you find that in general the left side's easier for things?
Yes. My right side is definitely the weaker.
Okay, this is down. This is up.
Okay.
What am I doing now?
My feet are down. I don't know.
Okay. This is up.
Mm-hmm.
This is down.
Okay.
What am I doing now?
Up.
Okay. This is up. This is down.
Okay.
What am I doing now?
Up. Down.
It's just a new pen. Does this feel different here and here?
Mm-hmm. It's sharper on the left.
Okay. How about over here?
I don't feel any either. My feet are numb.
Okay. Okay. Go over here. Just look straight there. Does that feel sensitive where I'm touching over here?
Mm-hmm.
How about over here?
Mm-hmm.
Does it feel like any of your headaches for now?
Mm-hmm.
Okay. Bend your head forward. Okay. Take this finger. Touch your nose. Touch the tip of your nose. Yeah. Touch my finger. Touch the tip of your nose. Okay. Touch my finger. Touch the tip of your
I
nose.
always struggle with this one.
Touch my finger. Okay. Try that with the other hand. Is that easier for you on the left side?
Mm-hmm.
Okay. Go like this. Try that on the other side. Now do them both at the same time. Fast. Okay. Now try like this. Over here, yeah, to the joint. Okay. Okay, you can put your hands down. Take your heel, put it on your knee, right down your shin. Try that with the other side. Okay. Do that again. Okay. Take this toe, touch my finger. Can you touch my finger? Okay. How about on this side? Okay.